This morning, we are turning now to an issue 11 Alive has been covering for years, maternal health and what's being done to tackle the crisis, especially here in Georgia.
Liza Lucas is pulling double duty this morning with an update after Governor Kemp signed a bill this week giving the green light to a new program aimed at helping mothers and their babies survive and thrive.
I see you smiling.
Lisa Stafford Johnson is relieved to be home with baby Daniel in her arms. The new mom works in healthcare, had special monitoring her entire pregnancy, but still was not prepared for complications from a surprise C-section.
It was a very scary experience, and knowing what I know, it still didn't help.
And Lisa's not alone. A forthcoming state report examines the risk for mothers and babies as disparities continue. Black women in Georgia die from pregnancy-related complications more than twice the rate of white women, and access to care across the state continues to be a problem.
We still have counties where there are no maternity care providers. If we want to make sure that these deaths are preventable, we need to invest in our women and families.
The state is trying to increase that investment with a home visit pilot program, a chance to intervene early.
Catch things like high blood pressure, any concerns with the baby, any of those maternal warning signs.
Home visit programs are not new, but DPH wants to build on what's working, like in Waycross, Georgia, where healthcare staff monitor high-risk moms at home throughout pregnancy. LaGuardia Matthews dealt with severe anemia and preeclampsia, closely watched by a home visit nurse.
My biggest concern was my blood pressure because they say that's like a silent killer.
Morgan Reynolds also knows how critical that support can be.
So when I did make it to the hospital, it was too late, unfortunately, and she was born at 21 weeks.
Morgan tragically lost her baby girl during her first pregnancy, but a home nurse helped her second time.
She was checking to make sure baby was moving, heartbeat.
The hope is the pilot program will bring care closer to families and ultimately save lives.
As a mother and a woman, I know what I felt going through that. Something needs to change.
And Liza, you've been one of the reporters following this story for us as well.
So when will the program launch, and a lot of interest in where it'll be available?
That's right. So the goal date is for July. The pilot program expected to fully launch this summer in 8 counties in South Georgia and 5 in Northeast Georgia, all in areas that are struggling with maternal and infant health. Now, we should also point out that the home visits go beyond pregnancy. So the majority of maternal deaths actually happen postpartum, and doctors say it's the complications that tend to arise at home that can be really scary. You don't know what's happening. So visits continue in that critical window.
We know you're watching and waiting for updates for when that state report comes out. We've been waiting for a while.
That's right. So not only do we talk about, waiting for this to come out, but what else is going to be a part of the report, because this is like multi-layered here.
That's right. We know the numbers are not going to be great given the pandemic happened during all of this, but we also know that this report is really going to focus on action both on a state level as well as what individual hospitals can do going forward. But public health officials tell me that they really feel like this home visit program is a key part of the solution, and it can ultimately catch things early, improve access and quality of care for moms and babies. Guys.